My name is Donna, and I live here in Catawba County, and my mother lived here with me for 4 years. She was fine when she first moved in, and then after about 3 years, she started to need some help. And I got a referral from someone that I work with who had used Unifour, and they said lots of good things, and so I had tried a different agency, and after 2 months had to let them go because too much drama. And so I thought I'd work off a referral and called Unifour, and actually by the time I made up my mind I had to start going back to school, and so I needed somebody right away. And I thought, this is really a long shot. How are they going to be able to provide somebody right away? Because I knew they had to do a care plan. They did. They sent somebody out the very next day. Then as time went on, I had the same person who came at 7 o'clock every morning, got my mother up and ready, and stayed with her until 10, and then a family friend came and stayed. And she just got my mother ready for 10 months. And she was kind, and she was generous, and she was punctual, which was a big help to me because I had to get to work. And when my mother was getting real sick towards the end, she would have a real sense of humor about having to clean her up, because not everybody's cut out to do that kind of work. But this lady who came to my house was very, very good with her and became like family to us. And then there were times that I would have something come up after work, doctor's appointment or a vet appointment for this one, or a meeting that was unexpected or something, and I'd have to call them and get service later on in the afternoon or evening. Sometimes I couldn't give them very much notice because you know how life happens, you just have to roll with it, and they always provided somebody. I never went without service, no matter how short of a notice I gave them. They were very reliable. I really felt like they respected my home and my privacy. When you take care of an elderly person, obviously their needs have to come first. And that's the job of the CNAs who come into the house, is to take care of that person. And with the other agency, I kind of felt like my own privacy and my needs were being stepped on a little bit and weren't that important. And I think the people at Unifour realized that, you know, it's not easy. And all the family members have to be respected and taken into consideration, and that they were real good about that. And then after a while, I needed nighttime care because my mother was getting more and more medically involved, and I was getting up with her 3, 4, 5 times a night, and then having to get up at 5:30 and go to work, which after a while meant I was not sleeping, and that's just a bit much. And so they started sending a night nurse who loves animals, and this one and his little sister, she just fell in love with them and brought them toys and treats, and they realized that pets are part of the family, and they sent people out who could deal with 2 little dogs, and they were just reliable. The ladies who worked here, both of them, I mean, there were a lot of people who came over the course of the period that they served us, but towards the end there were 2 that did the day shift and the night shift, and they were like family, and I miss seeing them. The last 18 days of my mother's life she lived in a nursing home because it was too much to care for her here, and they both came to see her, and I was there when they were there to see her, and I don't know if other people came when I wasn't there, but by then Unifour was not serving us any longer, and I think their motto is professional hands guided by caring hearts, and that was kind of above and beyond for them to go see my mother at the nursing home, because they were kind of finished taking care of her, but they grew to love her, the ladies who worked here, and so I always appreciated that about them. And I think for anybody who's checking this website out, who's looking for a nursing agency to care for a family member, you have to put your trust in someone, and if they're perfect strangers, it's hard to know if you can trust them. I was lucky that I was able to go off of a referral that someone made, but as I said, I did have a less than desirable experience before I went with Unifour because I just picked somebody out of a list. I have recommended Unifour to different people, But I felt immediately, because they jumped right in and started serving us, even though I wasn't able to give them that much time, they really do care about people, and you can tell when you can trust somebody. My mother was in the hospital in March for about 3 days, and when she came back home that very same day, their RN came over to update the care plan on her. And while the RN was here, I just got a slew of phone calls from home health, from physical therapy, from a doctor, from all these people. I was trying to care for my mother with one of the CNAs from Unifour, because it did take 2 or 3 of us. The nurse was able to handle all of those phone calls and coordinate the services and the medical information. I wouldn't have been able to do that. I don't have the knowledge, and of course my concern was my mother's physical need at that time. And so that was just a blessing to have her here. And there were other times when the RN came over, when things developed that I wasn't sure what doctor to go to, what questions to ask, what kind of follow-up I needed. Their RN came over and checked her out and gave me advice, and that's just invaluable. You know, it is difficult, and the medical community can be somewhat of a challenge at times. But to have someone like Unifour, they were a total support system for me. So I would definitely recommend them to anybody who's looking for someone to take care of their family member. It wasn't just a job for them. They weren't coming over here just to bathe and feed and give medication and dress wounds. They really cared about my mother as a person, about me as a caregiver. They truly cared, and I definitely felt that. Anytime I called, I didn't feel like they were on the other end of the phone rolling their eyes and, oh, it's her again. And they took time to talk to me. They would always return phone calls. I never went where I had to call 2 and 3 times to get to talk to somebody. They always returned a call. If the CNAs noticed something or had concerns about something that I might have missed, because when I would get home from work, I'd take care of her and get her to bed, and then, you know, catch up on housework and whatever and schoolwork. It was just helpful to have another set of eyes, and they really truly care about people, and it's not just a job for them.
Was it just old age with your mother, or was it a condition or something that was?
Well, she had dementia, which, you know, older people get. She had vascular disease, and from the vascular disease she developed ulcers on her feet, and one of the ulcers became infected with MRSA, and then she was on 3 different antibiotics before she was actually cultured to find out that it was MRSA. And the nurse was the one who suggested that I take her to a wound clinic, Unifour's nurse. I got more help from Unifour's nurse than I did the doctor's. And so that was when she was admitted to the hospital and treated for MRSA and came home. And then it took 2 other different antibiotics to dry the wounds up and get rid of the MRSA. By then, all of the good and bad bacteria in her system had been wiped out, and so something called C. diff, that's normally kept suppressed by good bacteria, was wiped out, and she just couldn't fight that. The RN, she brought silver over to put in the wound and said, talk to the wound care clinic about that. And I don't know why the doctors didn't do that. Because surely they have to see that in elderly people a lot, and people with diabetes would get that, and there's a lot of that around here. And so they really gave me direction to get the right care for my mother. There were 2 that were here most of the time, the night nurse and then the one who came every morning. But then at different times of the day when things came up, the person who worked at night, you know, would sleep during the day or had an earlier evening client, and the one who came in the morning, she would have later clients during the day. So if I had, let's say, a sports event that I had to chaperone, or a meeting or something that went later, they would send someone else. And that's something else I liked about Unifour, is that they never sent anybody that I had to call them and say, don't send her back. And statistically, that just doesn't happen. You know, there should have been at least one person that I wasn't crazy about, but everybody was so friendly and so kind. My mother was a very engaging person. She had a streak of naughtiness about her, and she could make mischief, and she would say crazy things and tell stories and do all her crazy stuff. And so people enjoyed her. And so I think that made it pleasant for the people who came here, that it, for the longest time, it wasn't just taking care of the wound and cleaning her up, you know, the unpleasantness, because she was such a sweetheart. And so people enjoyed her.